and Isabella. So the objectives of the presentation, we're going to be identifying communication techniques to use. You're going to understand communication techniques specifically for angry, emotionally unstable, and unconscious patients. And we're also going to go over the understanding the reasoning behind effective therapeutic communication tools.
So what is therapeutic communication? It's defined as the face-to-face process of interacting that focuses on advancing the physical and emotional well-being of the patient. Nurses use therapeutic communication techniques to provide support and information to patients. It may be necessary to use a variety of techniques to accomplish nursing goals and communication. So why is therapeutic communication important? It facilitates the client autonomy, creates a non-judgmental environment, provides the professional with a holistic view of their client, and reduces the risk of unconsciousness influenced by the professional. So these are the essentials. You always want to consider the patient's level of consciousness, age, language, culture, perceptions, and emotional states. So we always want to ensure the patient is at an appropriate state to communicate, and we also want to identify any barriers that will make this communication ineffective. So you always want to respect the client's personal values and beliefs, allow time to communicate with the client, use therapeutic communication techniques to provide client support, encourage the client to verbalize feelings such as fear and discomfort, and evaluate the effectiveness of the communication.
So the elements of professional communication, you want to make sure that you're showing courtesy. So basically, before you enter the patient's room, you want to knock on the door, you want to introduce yourself, say hello to your patient, and you also want to establish your purpose, tell them what you're going to be doing, like saying, hi, my name is so-and-so, I'm a student nurse, I'm going to be working with your nurse today, I'll be taking your vitals, getting you up in the morning, helping you groom, get bathed, and anything else that you will be doing. You want to use their name and specifically the name that they prefer. So what's on their chart, like what the name they have on the chart might not be what they want to be called. So you always want to make sure that you're asking, like, what do you like to be called? You want to make sure that you're establishing privacy and confidentiality. That's very important. You want to show trustworthiness. So basically, trustworthiness is doing things that even if you don't have to do it, so your patient's going to be able to trust you and understand that you're reliable. You also want to show autonomy and responsibility and assertiveness. So that's just basically showing that you are confident in what you're doing. That's going to show respect to your patient. So goal of therapeutic communication, you want to establish a therapeutic nurse-patient relationship, and that's through the communication techniques that we're going to be showing you. Identify the most important patient concern at the moment. You always want to make sure you're asking, what's your main concern? You want to assess the patient's perception of the problem. How do they view their problem? You want to facilitate the patient's expression of emotions, make sure that you're allowing them to express their emotions, because that's really going to help with therapeutic communication, and implement interventions designed to address the patient's needs.
So therapeutic versus non-therapeutic techniques. Some therapeutic communication techniques include, these are specific responses that encourage the expression of feelings and ideas that convey the nurse's acceptance and respect. Non-therapeutic communication techniques, the techniques that hinder or damages professional relationships by putting barriers in the way of open, trusting, and respectful dialogue.
So that's just basically showing the difference between therapeutic communication and non-therapeutic communication. So as you can see, you always want to use therapeutic communication because that's going to show respect and acceptance of your patient. And when you use the non-therapeutic techniques, which we're also going to go over, that just really affects the relationship, and that's the main goal, that you really want to have a good nurse-patient relationship, and that's going to be through the therapeutic communication techniques.
So these are helpful techniques to improve communication. You might be familiar with these already. We included the definitions if you weren't. These techniques ensure all information discussed between nurse and patient is understood and responded to respectfully, and these also help eliminate any errors when understanding the patient and provide the highest level of therapeutic communication.
So non-therapeutic communication techniques, you don't want to be demeaning with phrases, so using words such as you, place a demeaning tone to it as if you're complaining. overloading, so you don't want to talk too fast. Patients are often confused and they don't understand the medical terminology that you might be using towards them. Other things that we don't want to be doing in the hospital is giving false reassurance. And I'm sure that you guys have all learned this before. Never promise a patient something or anything really that you know will affect their health. So, and then also giving advice, we want to give the patient options, but we also don't want to be the person making their healthcare decisions. That's ultimately up to them.
I also want to add that you really don't want to make any false promises because that's really going to affect the relationship if you make a promise that you know you can't keep.
All right, so for the next 3 slides, I'm going to be just talking about the scenarios that you might often see this type of patient in the hospital. So the angry patient, therapeutic communication techniques that you want to be aware of is to always be prepared. You want to listen carefully to the nurse that's giving you a handoff report. Oftentimes she'll lead you to behaviors that the client is presenting on her shift or his shift, and then you can carry that over into your shift where you're better prepared. You want to listen, be empathetic, and you want to validate their feelings. That's the crucial part, is validating their feelings, because at one moment they might be happy, the next moment they might be angry, and kind of don't know what they're kind of going through, so you want to be able to validate their feelings. Always be patient with angry patient. That's a big crucial need that nurses need today, is being patient. We don't want to jump to conclusions until we find out everything. Also, you want to use language. So when you go up into your nursing or junior classes, you'll have a lot of questions about how you answer questions. You want to avoid using you, because that is demeaning. You can use the word I sometimes, but you don't want to say I think and then say you, because that's probably what the next word's going to be. What you're going to say is I think you should do something. And then you want to be accepting. So the emotionally unstable patient, it's one of the least understood patient populations in the hospital, making therapeutic communication very difficult. Like I said before, you don't want to use I think or you should. It impacts their free will. You want them to be the leader in their healthcare. You want them to make their own decisions that will improve their healthcare. You want to also acknowledge their pain. This is a problem that we see a lot in the hospital today, with nurses brushing off patients' perception of their own pain. Usually you'll see this with people who are in recovery from overdoses. When they say that they're in pain, they are actually experiencing that pain, but our perception or our biases about people who take drugs, that they're just seeking out for drugs. You want to remain neutral. You want to maintain a silent, therapeutic environment. Sometimes for emotionally unstable patients, silence is all they need. Let them think and reflect. And then you want to let the client decide on the first topic of conversation. And then the unconscious patient. So you'll see typically these patients in the ICU setting, people who are walking on a thread between life and death. Personally, when I've been working in the ICU setting at Einstein, I always go in, I introduce myself, and I tell them what I'm doing, whether they're conscious or unconscious. Unconscious patients, they'll probably be intubated, you're getting a tube down their throat that's supporting their respirations. So during this time, you want to introduce yourself, because the saying goes, hearing goes last, and sometimes people who do wake up from the unconscious state do remember what or who the people were in their rooms saying things. So you always want to be cautious of that, because you never know when their hearing goes. You want to talk with relatives and friends about the treatment that you're going to be giving to their family member. Makes them more calm, just makes the whole entire situation more calm. And then it can be difficult when you're in an ICU setting, because you probably only have 1 to 3 patients at most. Sometimes you'll often find yourself talking to these patients. So you want to talk about things that are easy, like shared experiences, holidays, things that are an uplifting mood.
Great, so I'm going to read a scenario, and there's going to be 2 responses, and one of them is going to be a good response, and one of them is something that you shouldn't say. So the scenario is, the patient was admitted 2 days ago with a diagnosis of cancer. She was informed by her doctor that course of radiation therapy was her best option. She became very upset and frightened about the proposed treatment, and stated that she wasn't sure she would go through. The nurse approaches her to discuss how she was feeling today.
response would be they're saying, "Hi, how are you doing today?" So, I was wondering how you're feeling about undergoing radiation therapy. The patient says, "I don't know. I'm not as fair as I was when I got here. I have a lot of questions about it." The nurse should respond with, "It sounds like that you have given it some thought. I'm sure Dr. Jones could talk with you and answer some of your questions. Would you like to do that?" A bad response would be, "Oh, you'll be fine. If I were you, I would just relax and trust the doctor. It would be silly to get worked up over this." That's not only demeaning, but it's like putting your own thoughts into the patient and stopping them from making their own medical decisions. So just don't want to do that.
And you're also making it about you when you say, if I were you, like you want to make sure you're really looking at the patient's emotions and not making it about you.
So this video that I'm going to play for you really quickly is just a demonstration about what to say and what not to say. Specifically for this video, it's talking to an angry patient. It's a really quick video, so.
So that was just like a good example of showing therapeutic and non-therapeutic communication. And it also showed like the difference between like well showing verbal and nonverbal communication, you also want to make sure that you're aware of your nonverbal communication. So in the first video, you saw that she was rolling her eyes, she had her arms crossed, she wasn't facing the patient, and that's like a good example of that nonverbal bad communication. When you have to be really aware of how your body posture is. So you always want to make sure that you're facing the patient, you're not rolling your eyes, you're at the level with your patient.
And then you can see in the second video how she correctly responded to the patient's needs. She acknowledged them and she answered them questions, gave her the patient options of what she could possibly do, and gave her a plan of what the nurse was going to do.
And the first one, she didn't assess her pain at all. She didn't really hear about the pain. But the second one, she made sure to address the pain. Ask her on a scale of 1 to 10 how bad is the pain. That's really important to do.
In conclusion, using therapeutic communication tools is a good way to connect with patients, build a rapport with them, and remain neutral so that the patients can take their fair decisions about their healthcare. But understand the differences in communicating with angry, emotionally unstable, and unconscious patients, and know the do's and don'ts of therapeutic communication.
These are just our references that we use to help us make this presentation.
We also have a cute video that we're going to go over. So if you guys want to participate in the audience, that would be great.
Oh. Alright, I'm going to cut that out.
Is it our computer or is it the program? It's like a real program.
Yeah.
Okay.
Did you have everyone?
Yeah.
Okay. There's 7 questions.
Oh my God. Alright,
Why is that so? That
I fixed it. Good job, John.
Okay, so blue is the right answer. Communication strategies with that supports the patient's well-being. It's not just with mentally ill patients, it's with older patients, and it's really between the patient and the nurse that you can focus on. Yeah, so paying attention to the facial expressions is a sign of nonverbal therapeutic communication. So paying attention to their body language, their facial expressions. You're not really speaking verbal communications, really what you're saying to them.
So which communication technique is not therapeutic?
Yeah, you never want to ask why questions. That's just going to
It's gonna make them question what they're doing is wrong. When you're like accusing them, like, why are you doing that? Instead of, can you give me an explanation of like what's going on?
when interviewing a patient, which nonverbal behavior should the person avoid?
Yeah, you want to sit squarely facing the client. You do want to maintain an open posture, but you never want to cross your arms or legs. So yeah, the last one, sitting squarely facing the client. For the first one in the yellow part, maintaining open posture, that's correct, but never cross your arms or legs.
Which of the following is a therapeutic communication technique?
Yep, restating is the answer. You never want to give advice on explain that moment.
Yeah, just restate. You want to give them advice. You want them to be autonomous in their healthcare plan. Things like if you want to see it in the sense of restating things that they said, make sure that they got it correctly, then that's okay.
And you don't want to have a closed posture. You want to have an open posture. And you never ask why questions.
You feeling good today is an example of an open-ended question. True or false?
That is false. When I ask them, how are you feeling today? If we ask them, are you feeling good today? That just, they can only answer yes or no, and you really want to have an open-ended question. So, but and the open-ended question would be, how are you feeling today? So that's open for them to respond in any way. And this is the last question.
Patient slams the door several times, which is an appropriate response by the nurse.
Yep, you appear to be upset. When you're saying please do not slam the door, you're disturbing other patients. That's really, you really want to focus on how they're feeling. You want to assess their emotions, and that's not really assessing their emotions. You're just saying stop, and you're focusing on the other patients, not your patient. You should cool off. I'll be back to check on you. Again, that's not really asking them how they feel. It's not really assessing their emotions. And you appear to be upset. That's showing that you're noticing their nonverbal cues. So slamming the door shows that they're upset. And when you say you appear to be upset, it allows them to explain and have that open-ended communication with you.
That was our presentation on therapeutic communication.
Okay, from the audience, do you feel like they spoke loud enough?
Yeah.
Yeah, okay. How about slow enough?
Are they gonna like cut this off, like us talking right now?
Should we stop it or just?
Yeah, I'll cut that out.
He said keep it going.
Yeah.
Edit it later.
Okay, so, content was really good. I didn't maybe notice one or two corrections with a word that, like, you might have been reading, but I think it's like not essential. I think that Kahoot got loud,
Yeah.
but is there a way that, like, if someone's viewing that, they can just look at questions without having, or is there a link?
I think it expires.
I think it's just because the volume in here is really loud for some reason.
Yeah.
Okay, I'm
Because even the
wondering how
video
it's
is
gonna record though.
I don't know.
When you go through this, you should still be able to see the question. It'll give you like the 7 seconds to go. If they can play the game, this will be able to play like actually.
Right, that's what I'm going.
They can just do it as like a pop second.
Okay,
You can't play it through the link. I have to actually like start it, kind of play. But I think like a good thing for him is he can mute like that first part where it was really loud, and then when we turn off the sound, like he can just unmute it.
okay.
You can, but I think can you do that?
Um,
We turn off their sound.
How do you just show the questions?
Everyone's supposed to.
Well,
Wasn't it like shows our screen? Yeah, it's screen sharing, so they'll be able to see it.
Yeah,
But they just
like
won't
they're not
understand.
gonna, I think they'll see a little box on top, but he said they'll see their full screen like that was on.
So whatever was showing on the screen is what they'll see. They just, if you mute it, they won't hear like the explanations of what
Right, right. Okay, so, that could also be discussion points, you know, between the instructor or whatever. So I'll see what he does with that. Okay, cause, yeah, that one screen sounded like there was like an audio glitch.
yeah.
It was
Yeah.
shaky or something. But yeah, it was really good. Okay, next. Who's next?
Was I going too fast? I felt like I was talking.
You
really
did
fast.
speak a bit fast.
Yeah, I noticed. I'm like,
Yeah.
oh.
Happens.
Isabella was a little soft, you were soft, Emily. I'm just hoping that like with the volume, they can bring it up.
Was that good?
Sure.
Perfect job.
You can ask me.
Well, it's up.
Your style could be better.
This?
We'll see if Andrew can play around with that, he's pretty good.
Oh, we did this?
Can we do?
I just have to. Oh, okay, dang.
Lucky.